Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today, there's one additional death due to COVID-19. I'd like to extend my condolences to their family, friends, and loved ones. Our current 5-day test positivity rate is 12.7% provincially and 14.3% in Winnipeg. 430 new cases have been identified as of 9:30 a.m. this morning, bringing our total to 45,579. Manitobans are all tired of the public health orders and restrictions, tired of hearing about the fundamentals, but we need to, ensure we're all still familiar with how severe COVID-19 is. Last week, Manitoba hit the grim milestone of 1,000 deaths, and today we're up to 1,011. Many Manitobans have recovered from COVID-19, but many have had severe outcomes, whether that be admitted to hospital, to ICU, and unfortunately death. We know that those in the older age groups and those with underlying health conditions were more at risk. These variants of concerns have shaken that to some degree. We're seeing younger and younger people admitted to hospital and into ICU. It's just a reminder of how severe COVID-19 is and how much it is affecting the health of Manitobans directly and also indirectly by putting strains on our healthcare system. So we need to, again, pay attention to the public health orders and restrictions, pay attention to the fundamentals, and really need to limit our contacts outside of our household. It's the best way to stop these transmission chains that we're seeing. If you have symptoms, even very mild symptoms, even if you're not sure, get tested, isolate pending results, have everyone in your house isolate pending those results. Stay home if you're sick. If you haven't yet already done so, please make your appointment to get vaccinated. We need to get as many Manitobans vaccinated as quickly as possible to try to turn the corner on this third wave. We could see in January and February of this year, our collective actions make a big difference. We saw our case counts coming down. We were able to get back to some of the healthcare services that had to be delayed in the second wave, and that was all due to our collective actions of following the fundamentals and following the public health restrictions. We're in that scenario again. We need to bring down these numbers. There's far too much strain on our healthcare system. There's far too many Manitobans in ICU and hospital with COVID-19 right now. We're at this again. This has been 15 months that we've been dealing with COVID-19, but we certainly need to stay focused. We need to bring these numbers down, and we know we can because we've done it again. We've done it in the past. We know we're starting our second week of these tougher restrictions, and we usually take at least 2 weeks to start really seeing the benefits of these restrictions. So we really need to focus right now, stay home, limit the contacts outside your household, and we'll bring down these numbers again. And please make those vaccine appointments as soon as you're eligible. Also wanted to take a moment here to speak about heat and heat exposure. Manitoba is seeing some warmer weather. Looking in the south of Winnipeg and southern part of the province, going to hit 30 degrees with some more hot days ahead. So heat can have some serious health impacts, physical health, mental well-being, cognitive ability. So we know older adults, those with chronic illness, those living alone, infants and young children, and people who work or exercise in the heat are particularly at risk of heat-related illness. So this is certainly preventable, so ensure you're taking care of yourselves and others, checking in on those that are vulnerable. And so for more information regarding heat and your health, be found on the Manitoba Public Health website. So I'm going to pass it over to Lanette at this point.
Thank you. Good afternoon, everyone. Manitoba's healthcare system continues to be stretched due to the high volume of case counts, which are resulting in more patients coming to the intensive care unit and the medicine units. As of midnight, there were 120 patients in our intensive care units, including 73 who have or are recovering from COVID-19. A reminder, our baseline for ICU beds is 72. 9 of the 73 COVID patients are under the age of 40. And there were 73 patients who were on ventilators this morning, including 50 COVID patients. I do also want to let you know that since January 1st, we've had over 300 patients who were admitted to the intensive care unit. And some of these were vaccinated individuals. They had their first dose of vaccine, about 34 of them. Almost all of those people who had their first dose of vaccine also got the virus within 3 weeks of their immunization, which is an important factor for us to consider, that when you get your dose, when you get your immunization, you need to still be cautious for about 3 weeks. And the evidence would show us that after about 3 weeks, the vaccine is around 90% effective, the Pfizer vaccine and the Moderna, and I believe the AstraZeneca as well. So getting the vaccine is really important. We encourage everybody to go out and get your first dose. Second doses, we understand, will be coming soon. And but just remember to be cautious for the first 3 weeks as you're letting the vaccine build up in your body. We continue to build capacity within the healthcare system. As you are aware, the last time I spoke on this topic, there were 60 permanent nursing positions that were identified to be posted and hired within the ICU. So we're very excited about that. And as well, last week we had 28 nurses who are doing a 2-week orientation in the critical care area. So they finished a week of theory. This week they will be on the units doing buddy shifts, and we're really so grateful for them for stepping up and supporting us during this time. We also have another 14 nurses who are starting orientation today, 8 at Health Science Center, 5 at the Grace, and 1 at St. B. We have our physician teams working together to cover shifts and care for more COVID patients than we have seen before. And we just really appreciate everybody's collaborative work together to support each other as we get through this time, this peak. We also encourage ongoing feedback from our staff, from our physicians. If there are ways that we can make this better, easier for you, if there's lessons learned that we need to, that we can improve upon, we want to hear from you. So please use your voice, speak up to your managers, and let us help you to get through this as well. As mentioned previously, one of our strategies to create capacity within the hospital is to ensure that the right patients receive the right care at the right time. And one of the strategies is moving, we call them alternative level of care patients, to personal care homes where their needs would be met and served well. So as of April 20th, 278 paneled patients who were either waiting at the hospital or they were waiting at home in the community have successfully been transferred to the personal care home setting. So I want to thank all the people in the hospital who are identifying these patients and getting organized for the transfers, the personal care home operators who are welcoming these people to their new home, and the families and loved ones who are helping us and supporting these moves. Some of these moves might be temporary to create capacity, but many of them are longer term. So we appreciate helping to expedite this. And patient flow is something that the healthcare system is always trying to do well in. It's part of what we do, and the hospital teams, everyone's working quite hard. Our goal in the past 14 months, as we've been dealing with this pandemic, is to provide a provincial response. And that means all the regions working together as one so that we can serve the people of Manitoba. So what that means is if you're in a hospital, in a rural or northern hospital, and you need intensive care, we will make sure you get access to the intensive care units. What it also means, though, is that if we have patients who can be cared for closer to home, and I'm talking lower risk medical patients, non-COVID patients, we may be looking at transferring you to one of those hospitals closer to home in order to free up capacity in the higher acuity hospitals where the ICUs are. So work is underway where the teams are looking at where there's opportunities. Of course, families and loved ones will be informed along the way, and we'll be looking at how do we, again, work provincially to ensure that patients get the right care at the right place at the right time, and we're all working together to make sure that happens. Because of the growing numbers of patients in ICU, we have had to scale back again some of our non-urgent and elective surgeries in order to free up some space and also to free up some staff to help out in critical care. Approximately 100 staff are currently actively redeployed, including 82 nurses. And I do want to just stress that we appreciate that delaying surgery is not the ideal situation. It is a short-term solution in order to manage the critical care demand right now. As you are aware, the past two slowdowns saw us get backlogged by about 16,000 surgeries. To date, right now, the health system is working at about 62% capacity as opposed to 100%. In Winnipeg, 1,246 elective surgeries were performed in the last 2 weeks. And so we're also looking at opportunities where we can work together provincially to maybe shift some of the surgeries outside if the acute hospitals need the space and the staff. Is there opportunity to do surgeries in different locations throughout the province, and so we don't have to delay the surgery any further. So ongoing discussions with that, and I will keep you posted on how things are going there. The other opportunity that we have and we continue to maximize is the virtual COVID outpatient program. We call it VCOP. And this is almost like a virtual hospital where people are assessed with COVID. They may or may not need oxygen. They can go home and be monitored. There is a team who checks in on them daily, and if ever there's a need to reassess, a paramedic will be sent to the home and either help stabilize the situation or transfer people to the hospital. Currently, there are 35 patients who are right now participating in the VCOP program, and 16 of them are on oxygen therapy. And this program right now is offered to patients who are at HSC, St. Boniface, and the Grace. We are looking to expand that a little further. And so far, this program has saved 751 hospital inpatient days. Because they're providing this virtual option for people. And we understand the feedback from patients and families has been very positive. People like being at home and feeling supported in that environment. So we will continue to lead the way on those innovative solutions. The Children's Emergency Department started last week accepting young adults under the age of 19 to their emergency department. So 17 to 19 normally are not going to Children's Hospital, but they are now in order to free up some of the capacity on the adult side. Since that time, 27 additional patients have been seen through the Children's Emergency Department, which averages about 5.4 patients a day. And a reminder for patients going to Children's Hospital, the visitor restrictions for older adolescents, they can bring one parent or guardian with them into the emergency department, but friends and siblings are not allowed. And so finally, we continue to work to free up capacity, to build up our staffing levels, and we are very grateful for everyone who's been supporting us. Our healthcare workers are tired, and you know, the message I would like to give is that we need to continue to follow these public health orders for the next few weeks. We don't know exactly if we're at the peak yet and how long that's going to be, but as we continue to see 400, 500 active cases, we know that's going to have an impact on the acute care system. So we are grateful to our staff for their unwavering dedication and their professionalism to patients throughout these past 14 months, and we will do everything we can to support you through the next few weeks for sure, and months if need be. We all need to continue to wear masks in public places. We need to wash our hands frequently, get tested if we have symptoms, and if we are a close contact of a known or suspected case, we need to follow the rules, and of course, get vaccinated. So the sooner we do that, the sooner these case counts will start coming down, the sooner our healthcare system will get the relief it needs, and we will be able to get back to our normal operations and the lives we're used to living. So at this time, we can open up the line to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CBC Manitoba, Bart.
Hi there, Ms. Siragusa. Yesterday, ICU physician Eric Jacobson told my colleague Aaron Broman that the ICUs have not had to triage patients for ventilators yet, that everybody who needs a ventilator has had a ventilator. How many more ICU patients can be admitted? I mean, what's our total ICU before staff in the hospital system have to start making those tough life or death decisions?
Well, hopefully we never have to make those decisions. As healthcare providers, our goal is to help heal and maybe comfort, but not make those decisions. So as you remember from the first wave, we built up capacity so that we would have the space, the equipment, the supplies for up to 173 critical care beds if needed. And we know that the limiting factor is staffing. So Dr. Jacobson is correct. We have not, at this point, had to make those decisions. And before we ever get to that point, we will maximize our staffing as much as possible. And we are looking at all options, and that will continue to be the case. We will recruit, which we are doing successfully. We will look at different staffing models. We will look at all the options before we ever get to a triage protocol.
Okay, thank you very much for that. Does triage protocol exist if you, through the unforeseen circumstances, ever got to that point? And I ask this question because people in the disability community, they want to know if such things exist.
I have Not seen one in Manitoba. I know that we've talked about if and when we need to have a triage protocol. We would certainly engage ethicists, and we'd also engage our clinical providers, specifically those from critical care, but also others as necessary. So to my knowledge, we have not, and I would be involved if that was coming to fruition. And I appreciate the sensitivities, Bart, and definitely I can understand that.
Thank you very much for that.
From the Canadian Press, Steve.
Oh, hi, Ms. Siragusa. Recently in court, you testified that at 129 ICU patients, the province was everyone was feeling as if it was at full capacity. And now we're at 120 already. So what is our capacity?
Our capacity is dependent on our staffing. So you are correct. In Wave 2, our peak capacity was 129, and it did not feel good. It felt everybody was stretched, everybody was stressed, everybody was tired, and not feeling good about the situation for sure. We learned a lot of lessons from that, and one of them is making sure that we support the team in critical care better with more orientation, with more education support, and so we are working to do that now. It's a little bit different than Wave 2 as well. Nobody was vaccinated in Wave 2, so we were losing hundreds of nurses, of staff every day because of outbreaks happening in different hospitals at different units, and the community spread as well. So it's a little bit different. I think almost all of our staff is vaccinated, at least with one dose, if not two, and there's not as many outbreaks that we're seeing in the hospital setting or PCH setting for that matter. They still occur and pop up, but they're not to the same extent that we saw in Wave 2. So we are not yet at 129. We will get to 129. We are admitting about 6 patients on average a day to ICU, and the unknown is how many people are transferred out at the same time. So it's just always every day there's a ebb and flow going in and out of critical care, and so we will. You know, it feels like every time we go through a wave, we get a little bit better, a little smarter, and a little more strategic. And so I don't know what the max number is. It's similar to the question about the triage protocol. We are going to do everything we can to support Manitobans and support the demand that comes into the acute care hospitals, and that will require a multi-pronged approach. It will be looking at a team-based approach. It will be recruiting more. It will be looking at who can do what, and we're just going to keep trying to meet the demand.
And the modeling released last Friday had an extreme worst-case scenario. And in terms of ICU bed occupancy, we're running well ahead of that worst-case scenario. It had us at about 60, 65 beds at this point in time instead of 120. And it had the peak predicted at about 124. So given that we're running ahead of that, what is the peak demand predicted to be? What do you see as being the peak demand?
Well, I expect we're going to get to 129 very soon, the way we're admitting people. It's really dependent on the activity, the COVID activity, the active case counts. It's dependent on how long these people are staying in the ICU. So we are seeing a younger population. We'll have to watch and wait if they recover and transfer out quicker, or do they stay longer? Like, there's a lot of unknowns. I don't know, Dr. Roussin, if you've been more involved with the modeling.
Yeah, and so the modeling can tell us on what scenario we appear to be on at the time that the model was made. It can't tell us what the trajectory will be after each iteration of orders, and it can't tell us what the adherence will be to those orders. So, at this point, we are, looking to see that trajectory change with the updated orders.
From CTV Winnipeg, Michelle.
Hi, Lanette. I'm wondering what is our peak capacity in hospitalization outside of ICU and in the second wave, and where are we now? Like, are more units being converted into COVID units?
Yeah, that's a great question, Michelle. Right now, it was interesting. About 10 days ago, we certainly saw the wave, the impact first hit ICU. We are now seeing patients being admitted more to medicine units. Right now, we're watching and we're managing. We're about 82% capacity on the medicine units, but we will start converting. Like, this is the thing, when people ask what's the maximum, it's really how much other services do we decrease in order to shift to meet the COVID demand. So we're at about 82% right now. If it goes up higher, if we need more staff or we need more beds, we will look at where there's opportunity. Usually surgery, unfortunately, is the first one we look at, and we would start doing that, which we did in Wave 2. We converted quite a few surgery beds to medicine beds. We will do that. We also didn't have VCOP back then, so we have basically a whole medicine ward living at home, but still managing them there. So right now we still have capacity. We are seeing it increase, and we will continue to monitor the situation.
Thank you. And also in regards to the VCOP program, how does this and how does all of the patients in hospital affect our oxygen stores? Do we have enough, and are we getting enough oxygen in to keep up with the demand?
Yes, I believe so. Our planning team is always watching the supply inventory, and I haven't heard any concerns as of yet. I asked about a week or two ago, and they said we were in a good situation and safe, but I will follow up and see if there's any changes to that.
From City News, Stephanie.
Hi there, Dr. Roussin. Manitoba last night hit the highest 7-day rate of cases across the country. I just wondered if you could tell me generally, how did we get here?
Well, it's the timing of our second wave. So for much of this calendar year, we had rates much lower than most provinces outside the Maritimes. And so as they peaked and are trending downwards, we've delayed our third wave here. So our trajectory is just delayed. So that's we've seen a number of jurisdictions each with their time as the hotspot, and now Manitoba will be there.
And Mr. Siragusa, we've been hearing that people have gone to hospital and they've shown symptoms that are similar to COVID symptoms, but they're refusing COVID-19 tests. Has this been a problem, and what is the impact that it has on staff?
That has not been raised to me as an issue, so I can't speak to it. Sorry.
From CHVN Taylor.
Hi, good afternoon. Well, now about half of all Manitobans over 18 have the vaccine, but we're still seeing very high case numbers. Can you just explain the impact the vaccine has had on our caseload?
Yeah, so the biggest impact we can see right now with the vaccine is the protection of the long-term care facilities. And so we've seen that a quite obvious benefit in those scenarios. We're seeing a decreasing proportion of those admitted in the higher age groups, those that have been vaccinated for the longest. And you're right, we're vaccinating more and more Manitobans each day. We're at over 50% for 18 plus. But as was mentioned earlier, the protection from that shot doesn't really take place for 2 to 3 weeks after the vaccine. So we're always going to have that lag between vaccine uptake and vaccine protection. And so definitely our vaccine trajectory is moving in that right direction. We're seeing some very good uptake, but we're going to need to continue that. But we're going to need to continue to be cautious regarding the public health restrictions while Manitobans are getting the benefit of those vaccines.
Yeah, along those lines as well, can you just explain a little bit more about why these restrictions are still in place and why we're still following them when we're getting more vaccines?
Yeah, I guess it's really that based on what I just was mentioning there is that, even when we have 50% of 18-plus Manitobans vaccinated, they're not all protected yet. There's going to be that lag, but that still leaves a lot of Manitobans unprotected. And so we still need to be cautious. We need to keep the transmission chains down so that we can get as many Manitobans vaccinated. So we're looking to, we need to see those high 70s protection. We're going to need people to get those second doses. And if we start seeing uptake like that, we're going to be in a good spot to start loosening some of these restrictions.
Thank you.
From the Winnipeg Free Press, Katie.
Good afternoon. Ms. Siragusa, you've asked for frontline staff to speak up, to use their voice during this time. We've been hearing from ICU doctors and nurses that they haven't been consulted, they haven't been adequately informed about the plans to expand capacity. So what can you tell us about how staff are being kept informed during the third wave, how they're being consulted on the plans, and how they're being clearly told what will be expected of them as we approach the peak?
Yeah, so the work has been ongoing for 14 months, and it's an evolving situation. So we have leaders, both medical and nursing leaders from throughout the province, who are coming together. They're sharing their experience and providing information for us, feedback. So if staff are not, and I appreciate, that's the hardest place in the healthcare system to be, is the frontline staff and the frontline manager. So the staff need to talk to their managers, and the managers need to make sure that they're talking to their senior leadership teams. And it's sometimes you get so busy in the day-to-day stuff that it's hard to pause, and sometimes it's even hard to think of the right questions to ask. But we would encourage everyone to raise it to your direct report, and I certainly, from a leadership perspective, would encourage everyone to make sure that communication both goes up and down, and people feel informed. And I really believe that it's the people who are working on the front line who know the challenges. They also know the solutions. So we want to hear from them, and we want to be proactive if there's things that we can do to help the situation, to help the staff, to help the patients and families. We have to hear those voices. So please speak up, and if maybe your voice isn't being heard, then you can take it, go as a group or go as a pair, or try, it may be face-to-face meetings, it might be emails. There's different approaches for different people, but we certainly want to work together. We have to work together in order to meet this demand on us.
Thank you for that. Dr. Roussin, how long did you know that Manitoba was on track to exceed the worst-case scenario projections for case counts and hospitalizations during this third wave?
Yeah, I mean, we were looking at multiple models. For a while, our trajectory was quite good, and began to change. I don't know on the exact date that we saw the quite dramatic turn in our restrictions, but when we started seeing that, we took a couple iterations to enhance the restrictions, and then on this last set, we were required to go even more strict.
From Global News, Brittany.
Hi, good afternoon. My first question is for Ms. Siragusa. We'd heard, you said earlier that we were seeing some patient transfers to hospitals that didn't have ICUs, that people might not need that urgent care. Are we doing any patient transfers outside the province to places like Thunder Bay, or is that being considered?
We are not as of yet, but that may be something that we have to look at. There's all sorts of options that we need to look at if we exceed our capacity in Manitoba. But at this point, no, we have not transferred, and I have not had any discussions with Ontario or Saskatchewan on helping us out. But I think any possibility could be available to us if we would want to explore if we needed to.
Thank you. And Dr. Roussin, just a few weeks ago, we heard from Dr. Atwell that, when we looked at Ontario, those case numbers went up. They likely waited too long to put in restrictions. He said, we're not going down that road. He could assure Manitobans of that. Did we wait too long? And ultimately, our hospitals and ICUs now paying the price of that?
Well, I think we did act. We've really never had very loose restrictions since November. So we really, at the end of January, really tried to loosen restrictions cautiously, but try to give that reprieve to Manitobans who work so hard to bring our numbers down. But we've always had very strict restrictions in place. And then we moved and had 2 iterations of further restrictions until we had to go to this further one. So, I think that what we're seeing in many jurisdictions is that this third wave, this variant, is much more infectious, and we're going to see that spike, which we're seeing now. But at the same time, we're vaccinating Manitobans at a very fast pace. So we do need Manitobans to adhere to these restrictions for a while longer, while we see the benefits of those vaccines.
From the Brandon Sun, Kim.
Good afternoon. Dr. Roussin, I just was looking for a comment from you regarding the enforcement. We've got, according to the Manitoba government's website, $163,000 in fines collected and just under $2 million in fines issued. And I'm just wondering, is it harmful for the government to see people not pay their fines? And if so, what kind of message do you think it's sending to Manitobans?
Yeah, I think this has been addressed. I'm not going to really comment on the specifics of the enforcement. Certainly, it's one of the tools that we need when we have these restrictions, but it is just one such tool. So there's more information coming out, weekly on the enforcement practices. But the details of your question should be directed, to government.
Thank you for that. As well, there is at some personal care homes where nurses are refusing to be vaccinated. And I'm just wondering, what are you going to be telling families who are fully vaccinated that their loved one may potentially be transferred into a personal care home where not all the staff has been vaccinated?
Is that a you question?
Yeah, I don't think we've. Not sure I have any specific details on any of that. So we certainly want to encourage as much vaccine uptake for all Manitobans, especially our healthcare workers, for their protection, but also the protection of their clients. So I don't really have any details on that.
I will say too, though, with the staff, we are making every effort to provide education and awareness about the vaccine and trying to improve access to it in terms of delivering it to the personal care homes for the staff to be able to get their immunization. And of course, we also, as the vaccine numbers are increasing, we are working with Dr. Reimer and Mr. Boda about how we can get people vaccinated while in hospital and being transferred out as well. So there's lots of options, lots of things going on at the vaccine task force.
From CJOB, Skylar.
Hi, Dr. Roussin and Nurse Siragusa. Thanks for your time this afternoon. Dr. Roussin, if we continue to see cases go up this way, there aren't many public health options left available to the province that haven't already been implemented. Is a stay-at-home order the next thing on the table if Manitoba has to implement more restrictions?
So we've had, like you say, quite strict restrictions in place right now. So we'll continue to follow these numbers through, through this week to see if we get any indication of a peak occurring. But like we often say, is we don't take things off the table if we're going to protect Manitobans if necessary. So we wouldn't remove any options.
Thank you for that. And as a follow-up to Brittany's question from earlier, Dr. Roussin, Manitoba is a little late to the party for the third wave, yes, and that may result in where our per capita numbers are at right now and how we're leading the country. But we were also late to the party, which means we had opportunities to learn from other jurisdictions. Why didn't that happen, and why didn't we avoid, the situation we're seeing now in hospitals and ICU beds?
Yeah, well, I think we did learn a lot and continue to learn. So a lot of our delay in this third wave might be attributable to some of our travel restrictions that we've had in place. We were able to vaccinate many more people in our population by the time the third wave did hit us. And we did act. We've always had very strict restrictions on this, and we've taken steps to make those more strict over time. And so I think it's just the nature of this pandemic, the nature of these variants that caused a very quick upturn in numbers, and we're going to be watching that for this peak, which we are hoping will come quite shortly.
Our final reporter this afternoon from CBC Radio Canada, Gavin.
Hi, Gavin from Radio Canada here. Ms. Siragusa, there was a moment this fall where Bethesda in Steinbach was near overwhelmed by COVID cases. So I'm wondering if there's any similar situations going on right now, or if you could just comment generally on what the situation is like for COVID-related hospitalizations at hospitals outside of Winnipeg and Brandon.
Yeah, I don't actually have that data for you available right now, Gavin, but I can see if I can find it. I don't have it at my fingertips.
Okay, thank you. And this might be for Dr. Roussin. I was wondering if you could comment on the closure of the Winnipeg School Division's play structures. Is this an effective measure to combat the transmission of the virus, or do you think this is, instead taking away a low-risk activity from parents and their kids?
A lot of these are difficult decisions. So I think, certainly outdoor contact is certainly safer, not without its risks. But there's a lot of things at play where right now our message is to mostly stay home, to try to reduce those contacts outside the household. And we know that a lot of these activities, while the activity itself might be lower risk, there's a lot of things that go into that. So people and parents gathering at the site, carpooling to it. So there's a lot of things. So the balance is difficult. So I think everyone's just trying to do their part to try to bring down these numbers. We're at a critical stage here.
Thanks, everyone. This concludes our media briefing.